Okay, you're now live.
Thank you.
All right, it's 12 o'clock, everybody. Sarah, would you like me to do a call of the roll for everybody here?
Yes, if you could for our meeting minutes, that would be helpful. Thank you.
Okay. Yeah. Good morning. This is the Dunn County CJCC Data Work Group meeting. My name is Katie Shelley. I'm the clerk of court. We have Sarah Benedict, the CJCC coordinator, Doug Ormson from the Dunn County Sheriff's Department in the jail, Sandy Frigo, criminal justice assessor. We have Megan Cartmeal from the Menominee Police Department, Brenna Jasper from the Menominee Police Department, and Hannah from the Dunn County Sheriff's Department. Can I get, oops, and it looks like Deanna Arnson from our Dunn County District Attorney's Office is just connecting as well. Can I get a motion to approve the minutes from September?
I'll move.
I'll second it, Katie.
Okay, all those in favor of the minutes from the September meeting signify by saying aye.
Aye.
Opposed, same sign. All right, the minutes are approved. Apologize, I'm just pulling my agenda up right now. We're on to the staff report.
All right, and I can share my screen so we all have the agenda up here. There we go. All right, and if we do have anybody joining us late, we'll just announce them as they come in, as we admit them from the waiting room. So staff report. So I want to start with, we have completed the sequential intercept mapping was done with our technical advisors back in August. We've just got the draft report yesterday, and they are requesting data from this year, anything that we can really pull together. So just kind of processing that request right now, but I will reach out to folks with an email if there's specific data that we think that you guys can provide. And they just ask that anything would be helpful. So if you do get an email from me, let me know if you have any questions. But just we're going to be pulling some data requests together for that sequential intercept mapping. Once they get the data and get some of our feedback, then they're going to finalize the report and then publish it. So more to come on that, I guess. Let's see, second point that I wanted to bring up is our deck work group is, they're going to be meeting on Wednesday, but they are really looking more at the data in general. So I did get the DA's office data on deck. The law enforcement and our human services are going to be bringing their data to the meeting. But as I mentioned last month, I think with this group, just really wanted to get this group more in the loop of the deck data because we're kind of the data keepers. So we want to make sure we're looking at all of the different components. So I'm going to bring that information back to this group, and we might want to consider adding it to our dashboard as we move forward. So just more to come on that. And then the third update is our quarterly CJCC meeting is scheduled on November 12th. That'll be the last CJCC meeting of the year. We hope to present on our data. We're going to talk more about that in a little bit on the agenda, but just wanted to cue people up for that. It'll be via Zoom, so anybody can join in if they want for our CJCC. So that's staff report, Katie, back to you.
Okay, number 5 is our monthly dashboards for September.
All right, I'm going to share my screen again here. I just sent this out. You may or may not have seen it. Let's see. I gotta pull up the right one here. Here we go. Okay, so yeah, this is super hot off the press. Rita just kind of finalized some things this morning. So similar trends of what we're seeing, I guess, under COVID. You know, the booking numbers are still down. And then the average daily population is still relatively down when we're looking at past years. When we look at, looks like Huberside's down pretty significantly in the jail. And then demographics, you know, we're just kind of monitoring those month by month. It's not too far off of what we would have seen 2 years ago. So I don't think we've got much outliers there. But what is continuing to be a trend is that we do see in that snapshot, at least that last day of the month, more of the folks are falling into that pretrial category versus probation and serving. Generally, what we're hearing from our probation partners is those probation holds have been down because of COVID, and just some updates from our partner, Paul Gilbertson. It sounds like DOC is planning on continuing some of these practices kind of moving forward. So I think more official information will be coming out on some of the DOC changes, but that's kind of bodes well for, I guess, that that population in the jail and on a hold. Any questions on jail data, especially since we've got Sergeant Ormson with us today? All right, moving right along. Looking at the proxy data, so the trends here continue where we're seeing that lower number of proxies coming through. The EBDM work group is putting together training for law enforcement on proxy. So we hope to kind of have some training videos by January. So, you know, with less people getting booked into jail, there's probably less proxies coming through. But we also heard from our law enforcement chiefs that sometimes the proxy is an after the fact. So they're not necessarily using it up front on that decision for that decision tool to keep somebody or to detain somebody, but it's more done after the fact when somebody's detained. So if our numbers kind of are going down as far as the number that are getting booked, we're seeing less proxies come in as well. So it's just something we're watching. Tend to see the same types of offenses, you know, where it's the AODA, drug and alcohol related offenses, and then disorderly conducts tend to make up the second most frequent kind of category. Not a whole lot, I guess, to report on the demographics. You know, overall, those kind of swing wildly month to month, especially when we're talking about just a small little sample group there. Any questions on proxy? All right. Looking at the different programs, I would just note that we've got a blank line here, so I'll have to see if I accidentally deleted something or if we added a new line there. I know I had to stretch the box to get this bottom one here. But I guess the good news is we're starting to see an uptick in referrals in the different programs. So the treatment opportunity program, pre-charge diversion, we're getting more referrals. So that just means more people are you know, getting assessed for the program, getting evaluated. We have seen the new enrollments go up as well. So that's just positive. On the treatment court side, both of those numbers are low. We've had terminations outpace graduations. Both of them are at half capacity. So we've got some work to do there as far as that recruitment and retention and engagement with folks to kind of bring those numbers up. Failure to appear. So I did rework this box a little bit just because we had to add one more box over here. We had to kind of adjust this. So just change the categories. So text in message reminders and then the opt-in, opt-out. Just kind of shorten that box a little bit. But, you know, we tend to see, you know, not the reverse, right? So for those that opt into the text messaging, you know, the theory has it they would be more responsive, more likely to show up. but we see the opposite, or at least a little bit more of them not showing up than those that are not even getting those text reminders. So that's just another practice that tells us the more people that opt into that service and can be notified when they have a court date, the more likely they are to actually show up for it. So we want to continue to encourage people to participate in that, that service. Any questions on this before we turn the page? All right. All right, so looking at some of the assessment, again, we've got Sandy back in the jail. She's doing contactless visits in the jail, but started that back up in August. But we're certainly seeing the same types of trends where we typically see that 30% identifying meth, the other 30% alcohol, and then generally high severity levels when we're looking at those mental health type symptoms. So numbers are kind of climbing back up and just consistent trend overall, overall there. Looking at the jail to community reentry program. So this program really has had some impacts because of the jail, because of the precautions in the jail. We're not having the volunteers come in the jail. We're not having the peers come into jail. They're doing remote work as best as possible. For the folks that are on the Huber side, they're not able to engage in the program. We just got orientation back up, but these are small groups. So we've got like 4 people that have started there. So essentially, because of the precautions, this program just really isn't functioning as it was designed to. So right now we're being safety minded, and we're following jail protocol, jail rules. So we are kind of shifting some of the services. So a lot of what the peer is providing is remote work. We're not likely to get that second peer started. So at this point, we are looking at kind of reallocating some of the funding that we have set aside for those contract services to provide perhaps some more direct housing support. We do hear that the folks that are getting released, they have more challenging needs. There's a, employment can be difficult right now. Housing is really, really short. And then just the that in-person staff, that peer support really is not there. It's more of that virtual peer support. So, so we're just looking at retooling that program for this year to really be based on the realities of what we're living under with COVID. So it's a good service, and people, it's voluntary. So the people that really do sign up are doing it for their own benefit, not for us telling them to do so. So any questions on, I guess, this page or anything on the dashboard that we covered? Or any errors or updates that kind of caught your eye that we need to make right now? Okay. All right. Well, I'm going to go back to our agenda then, and, well, hold on.
Okay, so we're at number 6, the recidivism project.
Okay, so this is, I can't wait till this is done, but I know it's never going to be done. I feel like I'm chasing these numbers over and over again. So right now, we still have some data, discrepancies, I guess, is the way to describe it, both in the pre-charge diversion and in the top program. So we have differences from what we reported as far as who completed the program on those on the Smashboard to what we have entered on our spreadsheets. So I'm going to have to get back with Deanna and Janae, because we've got to figure out where these discrepancies are coming from. So I did get some updated numbers from Deanna on the Smash board, but what we still have kind of outlined is the number that completed aren't matching up on our the spreadsheet. Janae just reworked all of the top numbers, and she found that the discrepancies are coming from these general discharges. So people that don't graduate and aren't terminated, they're essentially found not able to participate. So as we were kind of categorizing them previously on our dashboards, which becomes the Smash boards, those changed. So we have to now go back and update that spreadsheet, that Google shared spreadsheet, to reflect those, because that's what we're using moving forward. And that spreadsheet is that's the spreadsheet, right? That's what we're going to keep adding to. We're going to keep crunching those numbers. So I know that folks do have a lot of different spreadsheets or different lists, but we want to make sure that the shared one is the one that's up to date as possible. So what we do have is the treatment court numbers are finalized, but we do have to rework. And when I tell you rework, these are just off by a little bit. You know, what we've got 104 when it should be 105. So it's just like, where's that one person, and why, you know, why aren't these numbers the same? So we're talking relatively small numbers on the pre-charge diversion in the top program. But we want to make sure that this is it, right? That we can really stand behind it, and that it's the data is the data is the data. We're not wondering, you know, why the numbers are off. We did have a chance to present the data to our treatment court advisory. So I just wanted to pull up that. I'm going to do a new share, because what I would like to talk to the group about is really how we'd like to present this data. So I'm going to just switch over here and maybe switch to a different setting so you guys can see it a little bit. So when we looked, so this is the treatment court data that we presented to our advisory group. And this is 100% crunched and the numbers match. But what we found as we kind of updated this group last month is that we had a 77% success rate. So for those that graduated, they didn't come back 1 year post-program. That was 70% once we got to that 3-year mark. And then once we got to that 5-year mark, it did dip down to 57%. So some of the feedback that we got from the treatment court advisory group was really, if we could look at the number of arrests that on average that people had prior to coming into treatment court, and then look at the number of arrests that they had post treatment court, and then look at those types of charges to really see what are those types of charges that they're coming in on, because I think that's also going to show the difference, right? Because this is our highest risk, highest need population. So, you know, anecdotally, if we went from like 10 arrests a year to, you know, 1 arrest in a 5-year period, that's a real gain as far as them not coming back into our system as much. So they recommended that we, you know, if we could look at some of that data to add to the story, that could be helpful, especially when we're looking at these 5-year kind of post-program. When our numbers are, you know, just 21 people, 23 people, it's easily skewed. So it's just another way to see that there's gains being made. And oops, went too far. And then this just kind of shows our work, right? This kind of shows what years were more successful and what years weren't. We do need to really look more at those comparison groups. What we have right now for DOC, it's hard to see, but it's outdated. It's from like 2013. So we do need to dig for some updated recidivism measures. And again, we're not necessarily measuring apples to apples. So this was just some feedback from the treatment court advisory. But what I would like to learn from this group is when we're, this is going to be presented to the CJCC, and it's going to be a Zoom meeting. And we want to relay information, but not too much detail where it's not even going to be viewable, where you can't really consume the information. So I just wanted to get the feedback from the group as far as, I'm going to stop this. Really, how do we want to present this? What is the best way to kind of show what we're doing here? I'm going to just show one more thing, and that's just the document, right, that we've been using. And I don't think this is a document that is going to be good for charts. Maybe it could be if we just kind of broke it down. But this is essentially the data that we're crunching and using. And then we're going to have a narrative document with it as well. So I just wanted to get the feedback on really how we should present this in a way that relays the information. It's not too overwhelming, and it's going to be viewable on these online platforms. So I'm going to stop talking right now.
Sarah, could you use that chart like where you had like all the years broken up, like 0 of 2, and like I think that seems like an easy readable chart, and then maybe take some of the narrative from the first document that you had, and that might capsule all of it well together.
So like one, do we want to do like one chart per program instead of all of them? Yeah, okay.
I'm a fan of charts. I think it's easier to follow.
Yeah, I
Can you
think
repeat
Bart,
that, Doug?
I said I'm a fan of charts. I think they're easier to follow. People are
Good.
visual, so.
I agree, Sarah. I think bar charts or pie charts do a nice job depending on how much info you've got there.
Right, because that can be, yeah, easy to look at too, just where it's a real simple chart.
And it looks like Brenna commented too that she agrees as well. I think the charts would be good, and each program on their own chart as well.
Okay, any other thoughts, I guess, as far as the narrative document? I guess I was going to probably have that narrative piece accompany this, and and we can make it a report. This could be our 2020 recidivism report, because this is an annual thing, right? We're going to want to do this every year. So we could have the charts and then a little narrative document to go with it. Like we do with our dashboard, we've got that companion document that kind of follows. But then it would be more helpful to because these are also, we're in the weeds of all this data, but a lot of our stakeholders are not. So it's going to be important that we even describe what the pre-charge diversion program is. We've already got that narrative, so it's just really packaging it together so it makes sense all in one. I want to share one more thing, and this is...
Sorry if I missed anything. I got kicked off for a moment there.
Let me see. I gotta go back here. Hold on. This TAD report. Okay. All right. So this is the state TAD report that they just came out with. And this is kind of their narrative document, but really kind of outlining some of the strengths of the program. They, on a state level, did do a cost benefit. And as some of you recall, just was that a year or two ago, just when we were, trying to wrestle all the numbers so we could start to quantify. I thought this was really eye-opening. So and this is kind of based on the Department of Justice data analysis. So they got a whole section of just number crunchers that crunch these numbers to come up with this. But what they're showing, and I think this would be helpful for us to reference in our narrative piece, just that the state's report is kind of coming back and saying this, but for every dollar that's invested, treatment courts save $4.17, and then diversion programs save $8.68. And, I think that bears out with our numbers as well, because we've had so many more people come through the diversion program. Those are also generally the lowest risk or newer to our criminal justice system, where the treatment court, that's really, as we said before, that high risk, high need population. It's staff intensive. There's a lot more cost when it comes to drug testing and that supervision. So I think that bears out too. So when we look at our dashboards and even see that we've got 10 people in a program, we're not getting the most bang for our buck, because we've set aside a lot of the staff, the funding for a program at full capacity. So, that's why it's important that if we've got these programs, that they really stay viable and we continue to have the referrals coming through the system overall. When we're looking at the diversions, those can happen a lot faster because they don't wait till the back end of the criminal justice system. And then it essentially can prevent a lot of criminal justice resources going towards those. But I think this report has some really good information that we can reference in our written report when we're just talking about maybe not our particular numbers, but just what the state analysis is shown. All right, I'm going to end my share here and send it back to Katie.
I think the county board members like that cost saving thing. So I don't know if I think we should refer to it. I think they want to see that, not that the numbers are exactly the same, but it's something similar that they can quantify some number to.
Right, I agree. Yep, because a lot of, those are the folks that really are looking at the fiscal impact of programs.
Do we want to talk more about the comparison group, or we're good to go on that?
Yeah, so that is not anything that's going to be quick to materialize. We've got the idea that Sandy put forth to use that DOC population, but that's going to be a bigger term project, because that kind of came in probably a little bit later when we're looking at the comparison. So that's something that we can do, but it's not going to be ready or prepared. But DOC also has an analysis division down in Madison where we can ask them for that work. It just takes time for them to actually provide those numbers. But I think that's something that we continue to work towards, to get that apple to apple comparison, because that's what people want. Because when we're comparing these different things, it's just hard to know, is this good or better, or really how to value the programs per se, because it's more than just the dollar amounts that go into it, and that's part of the narrative too, is that we've got people working and paying taxes and taking care of their children and being responsible. So it's cost savings, but then it's also a lot of those social gains that people make from being part of these programs.
Okay, so let's move on to number 7, the data for OWI forum.
All right, so the communications work group just met yesterday, and we have identified a date for an OWI community forum. So that's going to be on November 12th, also our same date as our CJCC. So this is going to be a virtual forum for about an hour, and we're going to have law enforcement, our DA, and we're going to have Human Services and Judge Peterson really talk about OWIs. Just this is something that we've been looking at, this group kind of been looking at more in depth, but we want to have a communication message out there to talk about the data that we've seen that really compelled us to start digging in more to this. But then what happens, that process when somebody has an OWI. So we're looking to inform and educate the community. And then really what happens, you know, those additional costs that people have. So, you know, we know that we've got the cost of the ticket, we've got the criminal justice cost, but then we also have, they've got assessments that they need to do. They've got, you know, lose their driver's license. So we wanted to educate and then tell people we've got resources out there. We've developed a landing page that shows safe ride homes, and then we're going to get our posters out there into the community. So the message is, you don't have to drink and drive. You can go out and have a good time, you know, barring no COVID, I guess. But, you know, be responsible and safe about it. So we wanted to get that information out there. We've got QR codes that'll link right back to our webpage with safe options for a ride home. So this is kind of a bigger campaign, but part of it is the data. And we discussed yesterday, and Brenna, feel free to chime in at any point, but we discussed yesterday really using the OWI data and really making it simple and clear, and looking at some of the basic kind of demographics, that age, that blood alcohol content level. We had a really nice chart that we put together from our old data set. We're going to update that because it really just kind of sprinkles the each dot on the chart kind of shows somebody that had an OWI and what that blood alcohol level was. And as you can recall, when we first kind of looked at that, we thought, oh, you know, these will be people a little bit over the line or over the limit. And no, these folks were really far removed from the legal limit of what would be operating under the influence. So the message really from communication was to show some of that impactful data, but to make it really simple. Because again, we're kind of immersed in the data, but this is going to be for the general public, and we want to make it, you know, really clear, easy to understand, and where we're not losing them in the jargon, or again, where we have a visual that nobody can really see because we're doing this via Zoom kind of mode. Brenna, any additional that you would add to that?
Not really. I think the overall, and the plan is to sort of open with that information to, because we'll take some live questions as well. So to help sort of guide the conversation and be kind of a starting point for that. And for me, at least, that particular chart that Sarah's referencing, one of the more surprising pieces, in addition to the BAC levels that are like sometimes so high the person shouldn't be alive, let alone like able to function and drive a car, were the ages, because I think a lot of people think that the younger crowd is maybe more inclined to be a little more lackadaisical and drive when they shouldn't, and it is not the case as that data shows. So I think people are going to be at least interested to learn about what actually is the data here locally. And then I didn't catch if you mentioned it, Sarah, but we're coordinating that with distributing our Make the Safe Choice posters with that have like Safe Ride Home information, and it has a little QR code that you can scan. It takes you to the county website that has some resources for, you know, Safe Rides Home, whether it's local places or, you know, Uber and Lyft information. So.
Yeah, so thank you, Brenna. Right, so we've got this, you know, tons of data on the OWIs, but I guess we really want to kind of boil it down and use some of just more of those key points up front versus inundating with all of the data. But as we do this forum, we are going to take questions. So there could be other questions that come up or some follow-up kind of things that come out of this forum that we want to continue to look at the OWI data. But this, I think, is a great project for us to work on, really how we're linking the data to that communications message, trying to lead with the data to really show that this is an impact that we have in our community. And it's not only drinking and driving, but it's also that drug driving. So, you know, it's definitely something that impacts public safety and the whole criminal justice system from that first point of contact all the way through. So, I think it's just a really good message for us to get out there. And it's with the intent that we're not trying to scare people or, you know, it's really about education and being transparent in the process and helping people make, giving them the information to make those better choices.
And it's timely too, not just, you know, going into the holiday season, but I didn't get the chance to read the full article, but I saw an article headline the other day that talked about how liquor sales have gone way up since COVID, and you know, whether hopefully people are, you know, staying at home and don't make the choice to drink and drive and go between places, but that is another factor in this whole situation that just gives it a little more of a timely makes it a little more of a timely piece for us to address.
Absolutely. And getting out ahead of the holidays as well. It was part of our goal, because that's probably when our heaviest drinking and driving season is. So I guess any feedback or thoughts from the group as far as kind of our plan for that OWI data? All right. Okay, so we'll continue to work on that over the next couple of weeks, and a lot of you guys are involved in both of those work groups, so we will be kind of having smaller groups kind of look over that data to make sure, you know, it's in the presentation form that is going to work, you know. So I'll be connecting with Katie and Brenna on that as well. So.
Okay, we're at item number 8, so determine next steps. So I think we kind of have our plate full a little bit. I know Sarah and I talked, but I'll let Sarah go forward with this.
Yeah, I think as we talked about some of the next steps that need to be done. So it's really kind of prepping, I guess, for the 12th. We've got our presentation to the Cjcc, and then we got a presentation with that OWI forum. So it's really getting that stuff in good shape. And I don't know if we need to have another meeting before that. We could, but at least if I could send out the data for people to give me their feedback, and whether like this sucks, get rid of this, or, you know, add this. I think that can just be helpful the more eyes that we have on it, because, you know, I was looking at one chart over and over again and I never caught an error. I was like misnaming a whole category, you know what I mean? So sometimes it's really good just to have fresh eyes look at things again, and to get that initial kind of perspective. So I would like to send out both projects prior to when we're going to be delivering them to get your guys' feedback.
Yeah, that sounds good. As now kind of segueing into the next meeting date, if we don't need it before that November 12th, I know we get close to November or Thanksgiving if we push out to like the 16th or 23rd, but I don't know if, unless we want to have Sarah do a doodle poll, I'm fine with that as well. Or we can pick a date now.
Any thoughts, guys?
Do you want to do a doodle poll, Sarah? And I'll just send you a couple days to work for I and
Yep.
then go from
Yep,
there.
that sounds good.
Well, with that being said, then I guess this meeting is adjourned. We wrapped up here in a short time, and I hope everybody has a good rest of your afternoon, and we'll stay tuned for the